Hello, Dr. Paul Teich here. This is a video blog, one of my health tips, and it's concerning something called depersonalization. And I would just say, if you are taking any medication, certainly take it under the advice of a qualified medical doctor. However, if it is any type of antipsychotic, antidepressive, diabetes, or blood pressure medicine, you should open up the pamphlet that comes with it, which opens up to about 3 feet by 4 feet, written on the front and the back in the smallest letters you've ever seen. Almost no one I've ever heard of actually reads the whole thing and understands even the negative side effects that might happen. Today, we're just talking about one of them, depersonalization. So, my patient, Sally, came to me and said, I need to talk to someone. I'm behaving in ways that I have never behaved before. It doesn't really bother me or anything, but I do really worry about it. I said, well, what are you doing that's different? She said, well, I have found myself an internet boyfriend who I'm masturbating with, and I do it with lots of different people, and he hooks me up with other people who I can go to their houses and have sex with strangers. I have gone on, don't even want to say the letters of it, one of the adult meeting sites, which is specifically to meet people to have sex with, and I'm having sex with different people every day. And she goes, I really enjoy it, I really like it, but I've always been reserved in my whole life, and nothing particularly new has happened. I just started doing this, and I'm going down this path, and I'm kind of addicted, and I kind of do it every single day. She said I spend as much as 6 hours a day online with my internet masturbator, and her family hasn't necessarily found out. She doesn't think, but she does talk about legs up on the walls, yelling through the rafters of her house, raping herself in multiple orifices, which she never did before. And I asked her what medication she was taking, since there was no behavioral or familiar or even dietary change. And she had recently started a blood pressure and diabetes regimen, which is often that they do those together. One of the drugs, when we opened up the insert, said depersonalization. I'm pretty familiar with different drugs and different interactions in the body and negative side effects and positive side effects, what you can take it with, what you can't take it with, but I didn't know what depersonalization was. So we Googled it, depersonalization. Acting in an aberrant fashion that the person themselves maybe can't even believe that they're doing it. So totally devoid of reality and any way that they have ever been that almost the person themselves can't believe it. And that means millions of people across the world in this country are taking medications that they don't know cause depersonalization, which could cause you to become a murderer, a rapist, or start having sex with everyone that you can find around you because of whatever it does to your brain. It's making people crazy. So, long story short, this girl came in, said all these things are happening, believes it's destroying her life, and has lost control over it. I certainly recommended her to her medical doctor, to a psychiatrist, and a psychologist, and would hope that they would all get together and tell this person what to do. There is a whole entire story that she went through that takes maybe an hour that I'm going to put on another blog. Please read the inserts of your drugs that you are taking for prescription and see if it says depersonalization. We called the prescribing doctor for this particular lady who said, oh, depersonalization, I totally discount that. I don't even know what it is. I don't even think about that. I said, well, this woman is my patient also. These are her concerns. This is what she is doing. This is what she has done. And he basically wanted to get me off the phone. Basically said, get away from me, kid, you bother me. I'm another doctor, not another kid. The patient was embarrassed to call the doctor. I was consulting. I was helping. He didn't want to hear it. I had her write to the drug company after it had destroyed her marriage and family. And the drug company wrote back, "We don't care." I told her to write to the drug company and ask for $1,000,000 because they put depersonalization. Oh, gee, nobody knew what it was. Oh, I guess she should have known what it was. I believe there's comparable negligence, that the person is guilty for not reading their drug insert. Of course, they're not a drug rep, a doctor, or a pharmacist. The doctor is guilty because he didn't warn her. You know what? This can happen. So be careful. No one has been warned. I am warning everyone. The drug companies are evil. Evil and horrible. And people need to know. Depersonalization. Read it in your drug insert. If it's there, talk to your doctor. If he didn't warn you about it, he's a dumb doctor. If it has destroyed your life, get a lawyer. And let's have a class action suit and put some of these evil drug companies out of business. They don't care what they're shoving in us. They know what it does, and they don't care. They give us stuff that makes us crazy, causes depersonalization. They give us drugs that are supposed to make us less crazy, but one of the side effects is depersonalization. Man, if you can go to the moon and do stem cell research, you should really be able to give somebody an antipsychotic or anti-blood pressure medicine that isn't going to cause depersonalization. Look it up. There will be another video blog where we discuss the whole entire story of what happened with this girl's depersonalization. Thank you. Dr. Paul Teich, www.drpaulteich.com, and of course, you're viewing me on YouTube. God bless.